People, when they think of facelift, still to this day, think that you're gonna have that Joan Rivers windblown look and walk around looking like a space alien. That's not the case with the techniques that you use and with a deep plane facelift and when it's done by the proper provider.
You know, people have this idea that facelift is something where you're gonna just take away excess skin and make it as tight as possible. And the reality is skin is not a very supportive structure. Skin is a protective structure, but there's not a lot of support in skin, certainly as you get older. So one of the things that you lose when you get older is elasticity in skin. Elasticity comes from elastin and a little bit from collagen also. Collagen is kind of the strength and elastin is the snapback. You lose both of these as you age. Now, our injectors have some ability to try to improve that a little bit.
That's why I do a lot of biostimulators with Sculptra, with hyperdilute radius, and even with threads to try and build collagen and elastin. Also with Silfirm and our laser providers, they help to build collagen and elastin.
This is not a one or the other or an either or type procedure. So they have different foci and different goals. Injectables can add volume, they can stimulate collagen, they can stimulate elastin. Lasers can improve the texture and the quality of your skin. Surgery does not change the texture or the quality of your skin.
So a lot of times you need both, right? Because your skin doesn't get better with a facelift.
No, it doesn't. So what surgery does, surgery addresses the amount of skin and the position of your soft tissue. For example, in a facelift,
You're just looking at me. Okay.
I'm going to exaggerate facial aging.
No!
In facial aging, we have a descent of the malar fat pad, we have a descent of your jowl, and eventually you see kind of a scallop edge to your jawline. Certainly with fillers, we can smooth that a little bit. Some of the laser or similar treatments can help to tighten that skin a little bit, but ultimately, as these soft tissue descends, the best surgical approach to it is to address the soft tissue descent. In the difference between a true, real deep plane facelift and a so-called, I do a SMAS facelift where I tighten the SMAS. The SMAS is the layer of the face that actually is the supporting structure.
It's the muscular structure.
It's the fascia that invests the muscles of facial expression. And it's the fascia that contains the malar fat pad and the jowl. And this descends over time. And it descends here, it continues with the platysma, which creates the bands in your neck and eventually creates the stretch and the droop there. So in a deep plane facelift, we address the platysma from the front. We tie the muscles together and create the first part of our tightening sling. We can release the bands or cut across the platysma in the lower portion of the neck. And that's gonna also sharpen and deepen the contour of your neck. And then we're gonna come in from the side and we get into the deep SMAS layer. So in a SMAS tightening procedure, they just pull that a little bit tighter, but they don't ultimately address where that layer is actually attached.
And that's when it can look weird.
If I elevate the deep layer, I actually release the zygomatico-cutaneous retaining ligament. It's a ligament that basically holds that layer all the way down to your bone. And when we release that attachment, before I release it, there's this much movement. After I release it, there's this much movement. And it's gonna elevate your jowl, it's gonna elevate your malar fat pad, and it's gonna create a tight sling all the way under your neck. And that is a lasting procedure.
We're gonna do it next week.
After we do that, and we can elevate it, suddenly we have all this loose skin. I simply re-drape the skin without putting the tension on it, without doing that, what you call that Joan Rivers maneuver to make you look like you were in a wind tunnel.
And I think a lot of that too is they used to do a lot of brow lifts, a lot of hairline brow lifts, and that's not really what we do as much anymore.
Yeah, when I went into practice in Dallas, everybody that went to a plastic surgeon and said, I want a facelift, they got face, which, you know, I hear people say, I don't want a facelift, I want just a neck lift. A neck lift and a facelift is the same thing. It addresses everything from here down. But they say, oh, 20 years ago when I got a facelift, I got a brow lift, and we made a lot of people that look like this. And to me, it can be an elegant look, but it also, in a lot of people, to me, it just looks a little weird. It looks a little overdone. And I'm not a fan of the brow lift in most people anymore.
You and I both like people to look natural.
Yeah.
And that's the main thing.
You look at some fashion models and they have naturally high arching brows, but you look at others and they have kind of deep set eyes and these more foreboding brows. Both are beautiful, I think.
Yeah.
But I don't like to alter people's natural brow appearance unless they have angry brow like that. Then I think that a brow lift is necessary.
Okay.
Thanks for being my mannequin.
You're welcome. I will say, to his point about deep plane facelift, the difference that I see as an injector and seeing a lot of faces all day long, a lot of times the people who don't cut the SMAS is a superficial
muscular aponeurotic system.
Superficial muscular aponeurotic system, SMAS. That is what they
So it's not just cut it and then you
reposition.
Release the retaining ligaments. The strongest one is right here. And then
and
you can elevate all of that.
That a lot of you that are my clients and patients out there, I like to support that retaining ligament, sometimes with filler or a biostimulator to help with that grooving. Sometimes people that you see a groove between the malar fat pads, that's the retaining ligament that he's talking about that he moves. And then also, I see a lot of this when people get deep plane facelifts and they aren't actually cutting the SMAS and they're just kind of wadding it up with suture. If you wadded up my SMAS and you didn't cut it, I think you would kind of see it. And it kind of looks like a wadded mess right here. It would look weird. And so I think it's really important to go to a surgeon that you actually unpack these terms with, because educating yourself is gonna save you a lot of hassle, a lot of trouble. You want one really good facelift in your life, and you want them to do it the way that's best for your face and for you. And that's why you go to somebody who is super knowledgeable and has a lot of experience. Just like anything else, time on task is what's so important with everything that we do. And I think that the more you do, the more you learn and teach yourself, and because you can sit there and go to every educational seminar and all the different things, but if you don't feel it, know it yourself, you're not gonna do it well.